All right, moving on, chapter 1. This section is about dosage calculations. And honestly, this is really a brief introduction to it. Being in the nursing program, you're going to see a lot more of this. But what we're going to recognize is dosage calculations are simply conversions. And we're going to look at one specific type of dosing. Trust me, when you get into medicine, there's a whole bunch of different ones. Okay? And the one we're doing right now, we're assuming kind of solid situation, or whatever medicine is in a solid or a liquid form. And we're going to do kind of simple dosage calculations. When you start learning about real medicines and real drugs, since there's a bunch of different delivery methods, orally, IV, there's now inhale. There's actually other ways, but dosage values are going to be given to you differently, and how you deliver them is going to affect it. So we're going to do a simple dosage calculation simply to show you that it's just conversions. And then when you get farther on into nursing, you will deal with this a lot more. Okay. The main thing about dosing is there are kind of 5 rights of medication administration, how you administer medication. And as if you're in the nursing side of things, you are on the front line of this. And this is a critical aspect of your job. Not only the administration, but ensuring that the amount you're administering is correct. Don't assume that the doctor wrote it right, did it right. Check calculations, because you're the one that's doing the administration. Okay? And you're kind of that final line of making sure everything's right. All right? So, 5 rights of medication administration. The first is administration of the correct medication. So not only do we care about the correct amount, but you need to make sure it's the correct medication first, the correct drug. And that's simply understanding the situation, reading whatever's being prescribed, and making sure it makes sense, right? So again, don't trust what somebody else has done. Make sure that the correct medication makes sense and you have the correct medication. Second, you're giving it to the right person. So that's really important too, right? When you're busy and you're dealing with a bunch of patients, making sure that the medication you have is actually on the chart for the person that you're giving it to, and you're giving the right medication to the right person is critical. Okay? Third, what we're going to deal with here is administering the correct dosage. Okay? Giving them the right amount. And that might be based on a lot of things. It might be based on their mass, their age, what they need, and so on. Okay? So we're going to deal with masses only, or the weights. But when you get into nursing a little bit farther, there's going to be other things you need to deal with. Okay? Administering the correct method, oral, IV, etc. Some things you can do through IV and some you can't, right? If you're administering potassium, you can't do that typically IV because that will kill them, right? So potassium is what you give somebody for lethal injection when you're doing corporal punishment. Potassium stops the heart in high dosages. So, right, giving it to them through the correct route. And then if they've got to get it at a specific time, administration at the correct time. So those are the 5 kind of rules to follow for administering medication. So in this section, we're going to look at one way of dosing. And for example, when you've got tetracycline as your drug, you might read that 8 milligrams of tetracycline per kilogram body weight QD. And sometimes it'll say QD, and sometimes it won't. So that means based on the person's body weight or mass, we're going to determine how much of the drug we should administer. Okay, QD or BID or TID are the number of times a day that they should get it. And sometimes this is there and sometimes not. Okay? QD, and they're all Latin. QD means quoque diem, which means once daily. BID means bis in D, which means 2 times a day, or bis in day. And then TID means ter day, which is 3 times a day. 3 in a day. Okay. I had several years of Latin, so I kind of know those. Useless otherwise. But if it says BID twice a day, you're going to calculate the dose and then divide by 2 because you're giving their daily dose in 2 doses. Okay, unless it says otherwise. So, dosage calculation: 8 milligrams of tetracycline per kilogram of body weight. That is a conversion. 8 milligrams per 1 kilogram of body mass, or body weight. So we would write that, our conversion factor would look like 8 milligrams per 1 kilogram. So that's simply a conversion. If we know the body mass of the person, or the weight of the person, we can figure out how many milligrams of tetracycline to do. Okay, so, for example, the given dosage for tetracycline is 8 milligrams of tetracycline per kilogram of body mass. If the patient has a weight of 245 pounds, what is the correct dosage of tetracycline? Okay, so we got pounds and we need to convert to kilograms. So we know that 1 kilogram is equal to 2.205 pounds. So the first thing we need to do is take what we're given, the 245 pounds, the information about our patient, and convert that patient's weight to kilograms. So we're going to do 245 pounds. And this is a conversion, so we're going to make our little set of tracks here. And the pounds part of our conversion needs to go in the denominator. 2.205 pounds is 1 kilogram. Okay? That will convert the mass of the person, the weight of the person, to kilograms. Now we can take our dosage information, 8 milligrams of tetracycline per kilogram of body mass. So 8.0 kilograms, milligrams, let's try that again, milligrams tetracycline. Just going to write that as tetra, per 1 kilogram of human body mass. We can see the kilograms cancel, and the units I have left are milligrams of tetracycline. So doing our calculation, 245 divided by 2.205 times 8.0, right? Dividing by the numbers on the bottom, multiply by the numbers at the top, gives me 888.888 milligrams of tetracycline. We'll just write as tetra. They may have you do 7 figures, they may not. I'm going to do them here. So 888, so 3 7 figures, 4 7 figures, 2 7 figures. So that should be 2. The 8 rounds up. So we get 890 milligrams of tetracycline. Okay, so for our 245-pound patient, they should receive 890 milligrams of tetracycline. And since this is QD, that's once daily. Okay. Here's another example. Phenobarbital is used as an anticonvulsant. When used for maintenance, meaning that in the normal life of the person on a daily basis, the person should take a dosage of 5.0 milligrams per kilogram BID, which means twice a day. So if the patient weighs 127 pounds, what is the correct dosage? Okay, So the dosage that's per day. But we're going to do it twice a day. So we're going to figure out what the dosage is and then divide that by 2 because we're going to give that to them probably morning and night. So we got 127 pounds. We need to convert that to kilograms first. 127 pounds. Doing our conversion. 1 kilogram is 2.205 pounds. And then we know we got to do 5 milligrams, 5.0 milligrams of, I'm going to write pheno per 1 kilogram of human. The pounds cancel, the kilograms cancel, and we just have milligrams of phenobarbital left. So 127 divided by 2.205 times 5, 287.98 milligrams of pheno. Doing significant figures, 3 significant figures, 4 significant figures, 2 significant figures. So again, 287.98. So that's going to, we see 2 and 8 are significant. The 7 is 5 or greater, so we're going to round that 8 up. So 280 milligrams of phenobarbital. Right? So 287. Significant figures are only 2, so nope, that should be 290. Somebody should have yelled at me, right? Because we got to round up. So 290 milligrams of pheno. So I checked myself there. It's a good thing to do, right? Because I would have been a little bit low. So 290 milligrams of pheno. When you learn this in nursing, they may have you do significant figures. They may not. They may just say do 288 or something like that. Okay? But I'm going to do significant figures because that's what we do in science. Okay, a couple practices here. Again, pause this, do your calculations, come back. I'll run through them, make sure you get them right. Okay. All right, you're back. Hopefully you did the calculations. This first one, an 84-pound individual, is given an antibiotic that has a dosage of 2.5 milligrams per kilogram. We're assuming this is a 1 dose, not more than once a day. Or maybe we just need to do 1 dose right now and we'll deal with the rest later. Whatever. This seems like 1 dose. So we're going to do 84 pounds. Remember, we've got to convert to kilograms. Sometimes pounds is LB. Sometimes you'll see it as LBS. Means the same thing. Got to convert to kilograms first. 1 kilogram is 2.205 pounds. And our dosage is 2.5 milligrams. And this is antibiotic for every 1 kilogram of person. So the pounds cancel, the kilograms cancel, and the last thing I'm left with is milligrams of antibiotic. So 84 divided by 2.205, right? Because that's in the denominator, times 2.5, because that's in the numerator, 95.238 milligrams of antibiotic. Significant figs, 84 is 2, 2.205 is 4, 2.5 is 2, so I'm going to do 2, 9 and 5. The number after the 5 is a 2, so we're not going to round up. So 95 milligrams of the antibiotic would be our dose. Okay. Last one here, a painkiller that has a dosage of 0.025 milligrams per kilogram. Strong painkiller to a 131-pound individual. Again, 131 pounds per, so we know that there's 1 kilogram for every 2.205 pounds. And then our dosage is 0.025 milligrams for every 1 kilogram So we'll put milligrams of pain. We're not giving them milligrams of pain. We're giving them milligrams of painkiller, but you got the idea. Doing our calculation, 131 divided by 2.205 times 0.025 gives us 1.4853 milligrams of pain killer. Okay, significant figures 3, 4, 2. Remember, leading zeros don't count. So I'm going to round this to two significant figures. 1.4. The 8 is 5 or greater, so I'm going to round that up. So 1.5 milligrams of painkiller. Right? Again, when you do this really in nursing classes, you're going to go a bit deeper into this, but that's what we'll do for now.